All right, the big question everybody's wondering. As of today, would you plan on doing the other knee? Hey folks, FixItRick here. Today, we're going to do something a little different. Mrs. FixItRick just completed a week of post-knee surgery. They did a full knee replacement on her left knee. And we had a lot of questions going into this surgery, before the surgery. It's been now a week. We've had a lot of questions after surgery. And we thought it'd be a great thing to put on the channel to anyone who's considering knee surgery. And since this is a Fix It channel, I thought how appropriate to talk about fixing Mrs. FixItRick's knee. Let's get into it.
Hi, I'm Mrs. FixItRick, and this Fix It Rick couldn't do. We're going to talk about my knee surgery that I had last week. I had a total knee replacement and just the stuff that I'm going through. And we'll have some questions and answers, and hopefully it'll help you.
Let's get started. How bad were your knees?
Oh, my knees were horrible. They were bone on bone. And they've been that way actually for almost 20 years, if not longer. They would click when I'd walk upstairs and stuff. But now it came last year in 2024. We went on a trip to Europe, which is what we love to do, and then walked all over Amsterdam and Liverpool and London, and the next stop would be Paris.
And what made you decide to do the surgery now? If your pain is, you've had your pain for so many years, what made you decide to do the surgery now?
I just couldn't really walk anymore. It was hard to walk long distances without being in a lot of pain. And normally I could take the pain, but this is just too much.
And how that impacted travel?
Yes. We love to go to Europe, and Europe is cobblestone streets and sidewalks and uphill and downhill and walking everywhere. You know, they're not like us with cars to take you 2 miles away. You have to walk it, and I was doing pretty good until 2024 when I wasn't.
So what procedure did you have?
I had total knee replacement, which means they cut the top bone, I don't know whether that's femur or whatever, and then the bottom bone, took out the stuff in between and put new metal and plastic parts.
So how does the knee feel now?
The knee feels okay. I mean, it hurts. I don't feel like I have anything different in there. You know, I feel like it's my knee, but it hurts. I can't lift my leg. Like if I try to lift it like that, I'm in a lot of pain. But I can move it in smaller ways, and it's not so painful. But after day one, it was really painful. But the pain's going away slowly.
This is the end of week 1.
Right.
How bad was the pain this first week?
Right. This is the end of week 1. And I would say that through the week, I had the first day after the surgery, I would rate pain on a 3 or 4 scale, but that was because they loaded my knee full of all kinds of medicines and whatnot that I couldn't feel anything. And even my foot was numb. That's how much medicine I had in there. And they said it was just perfectly normal, so okay. But around day 3, I started feeling more pain. So all that stuff wore off, and I was maybe at a 7 or an 8. At night is when it hurt the worst, because I guess then I was just relaxed and it was in a straight position and it hurt. But coming out of it at the end of this week, so like yesterday and today, I'm probably at a 2, 3 if I exercise it too much. So when it started, the day after surgery, I was put on like a little regimen of Tylenol, and then Advil, and then 3 hours later, OxyContin. Now I could have skipped the Oxy and just kept doing Tylenol and Advil, but for the first 2 days, I'd say I did do that regimen of Tylenol, 2 hours later Advil, or 2 or 3 hours later Advil, and another 3 hours later Oxy. And that put it like at Oxy would be just before bedtime, which was a good thing. And I only took 3 pills of that and then stopped. And so right now I'm just doing Advil and Tylenol and switching that every 3 hours.
So now, a week later, how are you getting around? Getting from the bed to the chair and around the house?
I'm getting around like a champ. I have a walker that I use to walk with. That hurts my palms, but that's used for stability. But I'm pretty stable on my knee. I guess I didn't have horrible muscles or something like that, so the doctor did a particular procedure where I think he just moved the muscles over instead of cutting through them or something like that.
We wondered, and a lot of people ask us, why didn't they do both knees at the same time?
Yeah, that's a real good question. I know when I started the whole process of talking about getting knees, I wanted to do both because I wanted to chop, get it all done, and then be on my way on my merry travel way. But our doctor said, I could do it and I'd do a great job, but you have to do your recovery. And with 2 legs that are out of commission, your recovery will be harder, it'll be longer, and you might not do it as well as you should. So I decided just 1 knee, and let's see how that goes. And I was a little bit afraid of the whole process and that, so it's like, okay, 1 knee, we'll go with that. And boy, am I glad that I followed his advice.
Can you walk on it? Can you put weight on it?
I can, yeah. I can put weight on it, and I can walk. I am gingerly walking on it. It's not like I'm walking like I did before, and that's why I have the walker. I think eventually, maybe next week when the physical therapist guy comes around, he'll tell me, oh, you don't need the walker, just use a cane, and then you get off of that after a couple weeks. But I feel okay to walk, so I'll do that. Sometimes I forget my walker. I push it to a certain spot in the kitchen and then go to the sink and do something. And whoops, the walker's over there. So.
And this was outpatient surgery. So you walked out of the surgery and got in the car and went home?
Yeah, I pretty much limped out, but yeah, that's how it was. For me, it felt like it was 5 minutes because I went in, they put me in, 10:30, here she comes, puts me in the operating room. Next thing I know, okay, time to go home. It was like, whoa, okay.
Now they loaded you up with a lot of medicine in your leg when you left the surgery that day.
Right.
What was that like?
I don't know. Well, other than it didn't hurt as bad. And the only weird thing I felt was that my foot was so numb. It's like it went all the way to right about the ankle, and then I couldn't feel my foot. So when I would walk, it was a little odd, but I had the walker and I was hanging on and eventually it went from being the full foot to, the toes were getting better and I could feel those, but not the heel. And then it finally all went away, and now it's fine. It's like usual.
Day or two, not much pain, and then you felt the pain?
The first day or two I had pain, yes, and but not I felt it, but it wasn't as horrible as I thought it would be. Like, oh my gosh, I'm going to cry because it hurts so much. No, it was painful, yes, but I pushed through it. And the pain just kept getting less and less as the week progressed.
So you just went on Medicare. What equipment did you come home with?
The doctors gave me the walker. They gave me the walker. I suppose they did ask me if I had one at home. I didn't, so they gave me that one. And they gave me some sort of reusable ice pack thing that was pretty worthless. Kept falling off. And that was pretty much it. Oh, that's right. They gave me compression sleeves. Oh, I hate those things, but they're important because I'm supposed to be wearing them now, really. And they're supposed to compress your legs so your blood keeps flowing, so you don't get blood clots and you don't get DVTs, the deep vein thrombosis things. So
And they left a port in your hand? What was that for?
Oh, they left the IV in my hand for the first day. So when I got back, I had it there, and then the next day, a home nurse came and she administered a little baggie of antibiotics. I guess they gave me antibiotics while I was there, but this was one last round of it to make sure I don't get anything infected. And so she came, she hung out with us while that dripped into my vein, and then she took it out.
What does it look like now?
Nice purple racing track. Now, at this point, before I didn't feel anything, and now at this point I get itchies. Sometimes it feels itchy, sometimes it actually hurts, but I don't know why. It's maybe because I was exercising it too much or something, but it hurts.
And that's clear tape over it. What is that?
Yeah, I think so. I don't know, it doesn't come off on its own, or I don't know. I've been taking showers. I've had like 3 or 4 showers already for this past week, and it's not come off, and I don't think I've heard anything, so we're doing good.
You soak it in a
Right.
tub, but you can shower.
Right.
So you shower every day if you want to.
You could.
Okay.
You don't have to. You could kind of fake it and skip a day.
Walking in, day 1, day of the surgery, were you nervous?
Oh, yeah, I was nervous since I decided to do this, but yeah, I had a really good doctor, Dr. Danton Dungy, out of Chandler here. He's great. He put my mind at ease for a lot of things. You know, I looked at different kinds of methods that they use. He actually had his own method. He has a patented method that he used, not sure. But he put my mind at ease. But I was still a little nervous when I went in, you know, anesthesia and all. You don't know what's going to happen, but it was fine. I think I worry more than I should.
How's sleeping?
Sleeping, well, that can be difficult. I'm a side sleeper, but now I'm sleeping on my back. So for a whole week, I've been sleeping on my back, trying not to move.
In the bed?
In the bed, yeah. Oh yeah, in a bed, not in the chair here. So every night it's almost an experiment to figure out what will make my knee not ache when I lay down and I lay there like that. So I think we've come to the conclusion that if I use these great little pillows that I picked up at IKEA for a few bucks under my knee and under my ankle, then it's good. Sometimes I take a little blanket and shove it under my thigh too, and then it hurts the least. Okay, and I can move my foot over and things like that. I did start out with a great big, it's like a knee cushion, which I use during the day here on the chair because it lifts my leg a little higher, and then, you know, just I change the position when I can. But yeah, for sleeping, that's an experiment. So, but eventually you fall asleep, and especially if you take your meds right before bed, they knock you out.
So we talked about pain meds maybe, but what are you doing now for pain? They gave you opioids, but
Yeah.
They also told you could use Tylenol and Advil. What are you doing for pain?
Right now for pain, I take 500 milligram Tylenol, like in the morning, let's say when I wake up, 6 o'clock. And then 3 hours later, I'll take 3 200 milligram Advil, and then wait another 3 hours, and then I repeat, Tylenol, Advil. Now, because the pain isn't so horrible, I did the OxyContin twice. Once was 1 pill, and again, that was like a before bedtime. And then the next night, I did 2 of them because it was hurting really bad then. And then I stopped doing it after that. I'm not a pill taker, so I didn't care for that, but you really need to be ahead of the pain. So I figured, okay, well, I won't get addicted to it. I'll be fine, and just took it when I needed to, but then realized, oh, okay, I can work it out with Tylenol and Advil.
So physical therapy, how's that going?
It's going okay. I mean, the physical therapist has come twice so far. Yeah. And they said I'm doing great. because I can move my foot, I can straighten it, I can move my knee rather, and I can straighten it and straighten it while I'm standing. And I can straighten it if I have my ankle on a pillow and then pushing it down, right? So it's straight that way, that's okay. But there's one exercise that I have to do that I can't for the life of me. It's putting a pillow under your knee and then trying to raise your, oh, I might have a little progress here. Trying to raise your leg up. Not much progress, but you're trying to raise it up a little bit. And I can kind of get it up, but then it hurts. So I do like I'm supposed to do 5 to 10 of those. I can maybe just get 2 done, and then it's like, okay, this is really painful. But all the other ones, I seem to be doing fine. They tell you to stretch your muscles by moving your feet. Right now I've graduated to the 2nd level, so I stand by a counter and I do toe raises where I stand on my toes, or I do my, I call it ice skating, slide with my bad leg, or my now new leg, to the left and then back. So you do that across the counter. Not across, but next to the counter. There's all kinds of, a couple other ones. I have this cool little gadget. It's called a knee sled, I think. Is that that's what it's called? Mm-hmm. And you put your foot in it, and it's got ropes or elastic that you hang on to, and it helps you bend your knee. So as you're in a sitting position, it helps you bend your knee, which is good because it's hard. That's a hard one, and a painful one. So if you've got the reins in your hand and you pull slowly, carefully, it helps a lot.
How was the in-home care? Who came and when did they come?
So the first day after surgery, I had the home nurse come. She's the one that administered the antibiotics for me. Nice gal. Sat here and chatted. And removed the IV thing. And then the next day came 2 physical therapists, a guy and a girl, and they nice people, and they came a second time too. We've had them here twice already, and they should be here tomorrow, I think. So they come and then they just check to see, and they follow me around and make me walk and see how I'm bending my knee, if I'm doing it right, if I'm, trying to tell me what I'm doing right, what I'm doing wrong, and then adding more exercises to it. So far, I've been progressing, So
in addition to what they gave us when we, after the surgery, what gadgets have we purchased that we found helpful? What gadgets not so helpful?
So I heard that you need to really have your knee iced a lot to keep the inflammation down and take down the inflammation you come home with, and so we've tried all kinds of things. We had the reusable baggie that they gave us, which was very thin and would kind of slide off my leg, or if I put it this way, it didn't cover everything and we'd fill it with ice. Yep. And then so we did that a couple times and ditched that one. I also had I have Thera Ice sleeves, so they're sleeves for your knees and for your head and that kind of thing. So, and those are just gel packs that you put in your freezer. So we were using that for the most part because those are cold, and I could just put them on my knee and they weren't sliding off anywhere. They could easily mold to my bend, but they would get warmed very quickly. So we went to a good old-fashioned ice bag, and this is one of the bigger ones. Now I got water in it, so it'll probably slide off. But when there's ice in it, it just molds to your knee and nicely cools it off. Now it's pretty cold. Right now it's not so cold, so I don't have a little towel there, but I'll put a towel underneath it so I don't get frostbite. And this one works really well. And the one that I bought this one. This is a size 11-inch, and then I think they have a 6-inch, and then they have a little 4-inch one. So I'll fill the 4-inch one, and I'll put that one under my knee here, because I noticed that was pretty swollen too. So, but right now I don't. But typically, I'm sandwiched between ice bags. So that was for icing. I have my little knee sled thing. So this is actually just a memory foam kind of cushion, okay? And it has a second piece that's about this thick that goes on the bottom if you wanted it to go higher. But I used this one a lot in the beginning, and now it's just too cumbersome or too much. But to get into my chair, I'd kind of put it down, get my leg on here, and because we've got the recliners, it would easily lift my leg up. And these are great. It's good quality because I pull on this with my leg on there, so I keep thinking, oh, I'm going to rip it, but nope, it's sustaining its wear here. So this is, I don't know what you want to call it, knee raise, leg raise, what have you. Now, it is contoured, and I know that the physical therapist said they prefer that it's flat instead of contoured, but I think the contouring helps you alleviate some of the pain, so you can keep it, you can situate your foot and leg so it is straight, but then you can also slide it back so it'll have a little bend in it when it hurts you. So yeah, I would recommend that. I definitely recommend the ice bags.
How about an electric recliner versus a manual recliner?
We have a manual recliner, and I was in that yesterday. It was okay, but the electric's easy. Come on, hit a button and whoop, up go your legs. Getting into bed and out of bed is a little bit difficult.
Why?
Because this leg is stiff and it hurts, and I sleep on the left side, so I go in first with my right. Now I have to lift my leg up into the bed, and that's really hard. But I figured out that if I take, first I sit down on the bed, and then I'll hook my one foot under the other, my good foot under the newly fixed one, and then I can, because this one's a strong leg, I can pick them up, pick both of them up, and hopefully my pillows are in place that I can just go right over and plop it down, gently, of course, without hurting it. Getting out of bed in the middle of the night sometimes is very painful because, of course, it's been in one position for a few hours, and then when I go to take it off, sometimes the leg will slip, and it's like, oh, I feel like I'm breaking it, but of course nothing like that is happening. It's just that it's stiff and the muscles hurt. But
talk about the leg compressors.
Ugh, those are my friends, not. They have them so I don't get deep vein thrombosis, DVTs, and that's so you don't get any blood clot at any point from the surgery, that it goes, it could go into your legs, whatever, but you don't want it to go into your lungs. So they have that, and it squeezes, let's go, squeezes and let's go. I mean, it's kind of like a massage, but you hear it all the time. There's a buzz. They're hot. I'm a hot person, so things on me, too many things make me very hot. And they fall down, or when we put them on, sometimes they slip down to my ankle, and then as they expand and crack, it rubs my ankle. But it's not like I have any leftover marks from that, but it bothers me. So I'm not a fan, but I do it. And in regards to the DVTs, I also take one baby aspirin in the morning and one baby aspirin at night. That's supposed to thin your blood.
All right, the big question everybody's wondering. As of today, would you plan on doing the other knee? Yes,
I would plan on doing the other knee. This morning, I might have had a little bit different answer. I might have said I'd wait, but now I would, yes. And the only reason this morning was because I did more exercises, so my knee hurt a little more. So it's like, oh, okay. One at a time. One at a time is great. I want to do them, get this over and done with, because I don't like being like this. I'm an active person. I move around. I go all over the place, and this is holding me back.
All right, last question. Do you have any advice for anyone considering knee surgery?
Yes, my advice is do it, because even though I'm not fully through it, I think that at the end, it will be wonderful.
Remember to subscribe and hit that bell so you don't miss any future Fix It Rick videos. See you in the next one.